The NHS has similar challenges. What lessons could the UK take from Ireland's journey?
Well, actually, I think my answer is I think Ireland can learn a lot from the NHS.
Okay.
And
It's heartening to hear.
yeah, and I've been hugely impressed. As I mentioned earlier, the OECD say the number one thing if you want to transform, it's a political decision.
Yeah.
And I think the Health Secretary Wes Strading and the PM Sir Keir Starmer, they have led from the front. They said we have an NHS 10-year plan, and coincidentally, there are three major shifts, or the first three shifts that I talk about: illness to wellness, analog to digital, and hospital to home. But what has made them credible, like I live in Ireland, I occasionally watch BBC, but the number of times I've seen Wes Strading in a hospital setting or the PM actually talking to clinicians and understanding, so a real political commitment. Now in Ireland, we also have that political commitment. We have a health strategy called Sláinte Care, and it's unique. Everybody agrees on the strategy, but the execution has been so far from the political hype. So I think we can learn, from the NHS and just simply your practice here, looking at, we have similar problems in Ireland. Our GP practices, the phones are, it could take 3 weeks to get an appointment. And I saw the WIMSO, and I've invited you before at actually the UN in New York last year to talk about the WIMSO triage system. It's really effective. So I think it's all about figuring out the best practices and showing you, designing for it, and then adopting them really quickly. So I would suggest we could really work closely together. And we're collaborating, and we're working with actually an Exeter-based company, HCI, and we have a fantastic living lab at the Mater Hospital. In fact, we're now scaling tomorrow. I'll be in with Professor Sean Gain. We've had 6 to 10 PAH patients using an app that's giving them much better education, but they're also entering their symptoms on a regular basis. So Professor Gain and his clinical colleagues can see, well, those 3 patients actually need help, but everybody else is doing well. So I think this collaboration, I think, the UK and Ireland have always collaborated. We've occasionally had differences of opinion, but thankfully the relationship is much better now. So I think the opportunity to really collaborate, because we're English speaking, we have similar health systems, and I think it's a great opportunity moving forward.
Brilliant. It's always good to hear that the NHS is being highly regarded by someone else.
And actually not just in Ireland, I think around the world, the NHS is really seen as a pillar of excellence, and it's very clear it is challenged. The reputation is going down. You see more and more headlines. In Ireland, there are daily headlines about issues, but by collaborating together, we can fix this.